Hi guys, here's my short and sweet attempt at explaining DVTs and PEs. To begin, we know that a thrombus is a blood clot and that a clot can obstruct blood flow within a vessel. We see venous thromboembolic disorders in pregnant women because of venous stasis and hypercoagulation of the blood that occurs during pregnancy. In regards to our maternity patients, we typically see a DVT occur sometime during the course of the pregnancy, before the woman has gone into labor or has delivered her baby. DVTs also typically occur in the lower extremity. Signs and symptoms include unilateral leg or calf pain, redness, swelling, and warmth. When assessing a patient for a DVT, we are going to look for those signs and symptoms, and most importantly, we are going to physically look at the patient's legs and compare them bilaterally. Does one leg literally look swollen compared to the other? And then, are other signs or symptoms apparent in the affected leg? We talked about Hohmann's sign, and more we are finding that maybe this test is not as effective as other objective and diagnostic tests, like ultrasound or Doppler. In addition, if we already suspect our patient of having a DVT, we're not going to perform the Hohmann's sign in an effort to prevent dislodging the clot and causing a PE. Treatment for DVT includes ongoing assessment of the affected limb, anticoagulant therapy, which is usually continuous heparin IV, and bed rest during the acute phase. Once symptoms begin to resolve, the patient can be fitted for compression stockings that can be worn while they ambulate. Promoting ambulation with DVT is something somewhat new that we are having our patients do. In the past, we wanted them to stay in bed so that the clot would not become dislodged. A PE we know is a clot or former DVT that has become dislodged and traveled to the lungs. Unlike a DVT that typically occurs prenatally, PEs usually occur postpartum, and this is an emergent situation when this occurs because a PE could cause the mother to die. If your patient is experiencing a PE, treatment must begin immediately. I've made a list of symptoms that the patient may present with, but most likely the patient will appear in distress, will have difficulty breathing, and will be in pain. Again, when we assess, we will look for the signs and symptoms of a PE. We could possibly see or suspect a PE via the tests that I've listed on the slide, but the bottom line is, if we suspect the patient of suffering from a PE, we are going to call the provider and we're going to begin treatment right away. Treatment for PE includes continuous IV heparin until the symptoms resolve.